Hello, and welcome to my latest episode from Healing Sessions. Tonight, today, whatever time it is, wherever you are, we're going to be talking about a different mode of healing. And from the title of the video, you'll notice that what we're going to be talking about tonight is plant medicine, specifically psilocybin, San Pedro, and ayahuasca. Why did I pick this theme? Well, if you've watched my other videos, you know that I'm a healer. I am dedicated to helping people thrive no matter what the past trauma has been. And these plant medicines are a tool in our toolbox for healing. It seems like plant medicines have recently hit mainstream news. Everybody's heard about magic mushrooms, psilocybin. They're doing research with using the psilocybin specifically for depression, for PTSD, for other specific types of trauma. I don't think we're hearing quite as much in the scientific world about other plant medicines, though, like the San Pedro and the ayahuasca. So I'm going to talk a little bit more about those tonight and how we can integrate those into our healing process and how, even more specifically, how I use them here at our healing retreat in Ecuador. So for those of you that don't know, I have about 14 hectares, which is more or less about 40 acres in Ecuador. This is a healing center, and we focus not just on the coaching, which I'm sure most of you are familiar with now through the videos that I put out on the YouTube channel, but when a person is ready and when it's appropriate, people come here for these plant medicine therapies, these plant medicine treatments. So very briefly, I'll go over the three, and I'll talk about how we combine them and how maybe possibly they could help you on your healing journey, whether it's healing or whether you're looking for reaching another level of consciousness. Hopefully this, you'll find the information here beneficial. All right, so we'll start with the magic mushrooms with psilocybin. Psilocybin is not new. All three of these plant medicines, while they may be hitting news recently, they're by no means new. All of these plant medicines have been used by humankind for literally thousands of years. And even some of them, archaeologists have found as much as 10,000 years old evidence of them being used. So they are, first of all, they're very safe when used appropriately, which we'll talk about. They're very safe, they're non-addictive, and they support, excuse me, they support brain function in ways that are hard to duplicate. So psilocybin, magic mushrooms, the best way to describe this, if you've never had any experience with psilocybin before, is this is a medicine for the mind. This is a head medicine. This is a medicine for the brain. It increases neuroplasticity, but in the therapy, I'll talk specifically about why it's so useful in a therapeutic sense. Basically, in layman terms, what the psilocybin does is it breaks down the barrier between the right brain and the left brain. So unlike something like alcohol, where you're completely not coherent and you don't know what's going on, these therapeutic medicines are nothing like that. You are very, very much aware. In fact, that's why they're so healing with what they do, is because you are actively participate in your own healing journey. With the psilocybin, because it helps with this right-left brain communication, it allows whatever is stored in the unconscious mind. If you haven't had a lot of healing work going on, a lot of times what will come up first in a psilocybin session are things, negative emotions, traumas that have happened in the past. But the beauty of this medicine is that it helps us be able to look at it from a little bit more of a detached standpoint. So while the experience can be very intense, it also allows us an opportunity to be able to work through whatever comes up in the journey and heal it and let it go. One of the first things that I usually tell somebody when they're ready to do a plant medicine therapy is that these plant medicines don't give you anything that's not already in your mind to begin with. While there are visuals, hallucinating, that type of thing, the emotions that come up, the plant medicine does not give that to you. It just helps you uncover and face what honestly you're living with every single day anyway. This just gives you a safe place to explore that. So we'll talk about why potentially somebody might have the bad trip a little bit later. First of all, I'm just going to give an overall view of the three plant medicines and their place in plant medicine therapy. So the psilocybin, that is a mind exercise. That is for helping to heal the mind. San Pedro is a cactus. It's in the mescaline family, and they call it in Spanish. They call it el abuelo. It is the grandfather. This plant has a very masculine energy to it. It also tends to be a more of a physical type of medicine. So while the psilocybin is something that's going to help heal the mind, San Pedro is the medicine that helps heal the body. Maybe you've heard or read about how the body can store emotions. There's great books that you can read on that. The Body Keeps the Score is a great one. Anybody who kind of works in the mind body connection will also automatically understand that we do have energy that gets stored in our body. That's why sometimes if you get a massage, you might have, knots in certain muscles, which can cause a release that either makes you feel like crying, or it's a physical release. And San Pedro is the medicine that helps clear what is stored in the body. The other aspect of San Pedro, which I think is such a beautiful combination, is you do get learnings from these plant medicines, aha moments, if you will, communications from your higher self, from your inner self. And the communications and the learnings that usually come with San Pedro are grandfatherly. I mean, if you can kind of imagine, maybe the difference between going to your mom when you have a problem, a mom is a little bit more inclined to be like, oh, you know what, that's okay. Let's talk about how you feel, whereas the masculine advice is going to be like, you need to get this together and you need to do this and you need to do this. And the San Pedro, because it's the masculine energy and the grandfather plant, tends to give us learnings that are very practical of what we need to physically do to help heal and solve the problems. So ayahuasca, when we compare it to the other two, this is the soul plant. This is the heart healer. This is the plant that wraps itself on the inside of you to heal what's hurting your heart and your soul. So while the psilocybin is what we use for regulating the mind, and San Pedro is what we use for healing the body, ayahuasca is what we use to heal our soul. Frequently, ayahuasca comes with somewhat of a purge, depending on what your state of mind is too. So we'll talk a little bit about prep work for ayahuasca. But if you read about ayahuasca, you'll typically read that it can cause vomiting, it can cause diarrhea. A diet is recommended, either vegan or vegetarian, being careful that you avoid highly processed foods, meats, usually salts, sugars, refined things, those kind of things. It's beneficial if we we can do kind of a fast and eliminate those out of our diet for as long as possible before the plant medicine, but minimum of a week. The reason is because we want our digestive system to be able to relax. But more importantly, when a purge happens with ayahuasca, which for every human is a little bit different, the shamans do believe that we are not purging anything from our digestive tract. We're purging stuck energy. we're purging the past, we're purging the pain that we've gone through. And once this is out, hands down 100%, well, I'm sure nobody, maybe necessarily is like, woo, I can't wait for the purge part. It is a necessary part of the healing, because just like with the San Pedro, which helps relieve energies that are stuck in the physical body, we have energies that are stuck in our soul, things that we fear, things that we're afraid to face. And there's the emotional aspect that's tangible. And that's what ayahuasca very lovingly helps us get out of our systems. So the three of these medicines combined really is the mind, body, and the soul, the mind, body, and the heart. And when a person is on a healing journey, that's what we need. We need all of us. We need all of our aspects to be supported as much as possible in this healing process. It would be really great if thinking or reading a book would be enough. And maybe for some people that is, but for the truth is that for most people that have gone through trauma, whether it's religious trauma or domestic trauma or just life in general, people who are looking to reach another level, the combination of these three plants, obviously not in the same doses, but when somebody comes down here for a treatment, we will usually do the psilocybin on the first day, then we do a rest and an integration day, then we do San Pedro, and then a rest and an integration day, and then we do the ayahuasca. So we will do the 3 plant medicines within 5 days. A little bit, that's kind of it in a nutshell, but it's a little bit more complicated than that. So while I said that these medicines have been around, safely used by humans for literally thousands of years, we have come to a different point in time. We are not using these plant medicines anymore. And for the most part, the majority of the population has not had any sort of access to these plant medicines for a long time. So while the indigenous populations have continued to use these on their cleansing journey, Westerners, people who come from more industrialized lifestyles, we face some unique challenges. We face some unique challenges. So if you could imagine that maybe these plant medicines are a little bit like taking a bath, that's great when you're from an indigenous area where you've ritualistically participated with these healing plants since puberty. These healing plants are part of these cultures' lives regularly from youth on. And that's great for them. They have their way of doing it, and that's would be wonderful if all of us could also do that. But the truth is that most people who are looking for these plant medicines for their curative properties, they need a little bit more structure and they need more integration. And honestly, it's a little bit harder for Westerners because we come to this plant medicine, at 30 years old, 40 years old, 50 years old, and it's like the first time we've ever taken a bath. So you can book retreats for San Pedro and ayahuasca, and you're in the jungle and you watch the shaman beat on drums, and that's, the authentic experience. But in my experience, the way that indigenous people practice the plant medicines is not the most effective use for us. So what is the most effective use for Westerners? Maybe you've heard that set and setting is the most important thing when it comes to using plant medicines, and I concur with that 1,000,000%. But I would like to take it a little bit farther in saying that I work very specifically with the individuals in preparation for any sort of plant ceremony for a minimum of 2 to 3 months first. And here's the reason why. We're not indigenous. We are not used to these kinds of emotions coming up. We're not used to this type of healing therapy. So by having coaching sessions for the 2 to 3 months first, what that does is it kind of paves the way. There's multiple reasons for that. First of all, our psyche, we're kind of like onions. We've got layers, you take off the first layer and then you got this other layer and then you got these other layers until you get to the core. And the plant medicines, all three of them, excuse me, they're going to heal what is on the surface first. So with coaching, there are a lot of things that we can heal and get it out of the way. So when you're ready for the plant medicine, we've cleared out the cobwebs. We've, dusted and got rid of a lot of stuff because why come down to Ecuador and take care of a surface matter that we could have taken care of 45 minutes on the phone? So first of all, the coaching serves to get rid of a lot of issues, of a lot of easier things, so that when a person is ready for the plant medicine can go deeper to the core. Secondly, when we do the coaching first, it creates a really safe trust factor. And that's part of the set and the setting. So I'm sure you might, if you've ever thought about plant medicines, maybe the thought of going to a strange place with a strange group of people is kind of an unknown, and that can make some people feel a little bit more fearful. So as you've been working with me for 2 or 3 months before your plant medicine experience, now you know me. I'm not a total stranger, and I know you. That's beneficial because if anything comes up unexpectedly in the plant medicine therapies, you know me. I'm not a total stranger. I'm not some unknown person that, some random person. We are already working together. And it makes whatever issues come up a whole lot easier to talk about. First of all, I am rarely surprised by anything that happens in a plant medicine ceremony, mainly because I have enough experience doing both of the coaching and the plant medicines that it becomes a lot more predictable, even if it's not quite predictable for the client. I am prepared. I'm ready. And because of that trust factor, like I said, it makes it easier to work through whatever difficulties might come up. The other thing that the coaching allows us to do too is really customize exactly what you need. In a lot of indigenous ceremonies, it's more of like this, here's this same doses for everybody. Everybody takes the same thing, and it's like a one and done kind of thing. And I don't believe that humans, especially Westerners, this being first time experiences, I don't think that's really unleashing the full potential of what an individual needs. So during that course of time, I'm also gauging to figure out which of the plant medicines you'll benefit from the most. Also, what kind of doses I would need to give. Because the way we work here is everything is 100% customized. We do not have 30, we're not pumping 30 people out per retreat. These are customized. I have never done more than 3 people at a time, and those 3 people knew each other. Again, that's kind of in the setting, in the safety, in the trust zone. Honestly, I don't know how to manage 30 people on psychedelics in a room. I don't know. Well, I do know. They don't really handle, they're not giving customized attention. In some of the retreats out there, some of the people that are guiding and directing the retreats, they may not even speak English. That's fine if you're looking for that kind of experience. But if you're looking at something that is customized for the specific healing needs of Westerners and that care, this is the reason why we do this. We do the 2 to 3 months of coaching first so that we can eliminate what can be eliminated just by the phone calls, so that the trust factor is established, and also so that we can determine which of the plant medicines are going to work for you, as well as what the doses needs to be. Some of the questions that I then will hear is anybody who's researched any of the plant medicines, usually one of the first things that come up is fears of a bad trip. So again, set and setting is hugely important. While you might be able to take yourself on a trip by either finding ayahuasca or finding mushrooms or whatever, I do not recommend that because of the bad trip. A bad trip happens when there is something intense that comes up and the mind can spiral. It will twirl around it. You know, it's like a piece of something that the mind just starts twirling and twirling and twirling and twirling. And it's the mind cannot always figure out how to untwirl. It sometimes doesn't figure out how to look at it from the other objective. And that's why the guide aspect is so important, because it's like I said, it's not like alcohol. If you've never tried the plant medicines, it's kind of hard to describe, but you are in an altered state of mind, but you're still there, you're still coherent. And so having a coach that you trust, that's able to take you by the face and say, look at me, sweetheart, you're right here with me. You're right here. Let's talk through that. That groundingness and that guiding is what eliminates bad trips. Are they intense? Yes, we can absolutely have intense trips. Sometimes, or maybe all the time, the more intense the trip is, the greater the healing. The more serious that was, the more you need to get it out of your system. So of all of the trips, all of the experiences that I've ever guided, not one of them has ever ended up bad. Intense, yes, but not a bad experience. These plants bring out what we need to heal. And like I said before, they don't do anything to you. All they do is, it's a mirror. It lets you see what's already there. Okay, so that's kind of my crash course on psilocybin, San Pedro, and ayahuasca. I am going to be doing more videos on these specific plant medicines because not only do I do the coaching, which I've done for over 20 years, but I am working hands-on